Hello, my name is Margaret Brown, and I am a registered occupational therapist with experience practicing in a variety of settings. I am going to walk you through the new and updated guidance for Section J, health conditions. The objectives of today's presentation are to identify the new and revised pain assessment items in Section J and to discuss the guidance changes for the Section J pain assessment standardized data elements. In the MDS 3.0 RAI version 1.18.11, general revisions and updates were made to the Section J items to enhance clarity. For the pain assessment interview items specifically, updates were made to replace 5-day look-back period with last 5 days. Minor changes were made to enhance the clarity of J0100, pain management, and J0200, should pain assessment interview be conducted. For J0100, pain management, the guidance statement has been updated, directing the assessor to determine all interventions for pain provided to the resident anytime in the last 5 days. The pain assessment interview, which includes items J0300 through J0600, had the following specific modifications. The coding instructions and skip pattern in J0300, pain presence, were updated. The response options and coding instructions for J0410, pain frequency, were revised. New data elements J0510, pain effect on sleep, J0520, pain interference with therapy activities, and J0530, pain interference with day-to-day activities, were added. As a reminder, the intent of the items in this section is to document a number of health conditions that impact the resident's functional status and quality of life. The items include an assessment of pain, which uses an interview with the resident or staff if the resident is unable to participate. The pain items assess the management of pain, the presence of pain, pain frequency, effect of pain on sleep, and pain interference with therapy and day-to-day activities. We will discuss J0200 through J0530 in this presentation. We will start by discussing J0200, should pain assessment interview be conducted. The coding instructions for this item were revised for clarity. According to the coding instructions, assessors should attempt to complete the interview with all residents. Additionally, the coding tips were enhanced to clarify the skip pattern for this item. If it is not possible for an interpreter to be present during the look-back period, code J0200 equals 0, no, to indicate the pain assessment interview was not attempted. Skip the pain assessment interview items, J0300 through J0600, and complete the staff assessment of pain item, J0800. Let's move on to J0300 through J0600, pain assessment interview. The following new guidance has been added to the item rationale for the pain assessment interview. The assessment of pain is not associated with any particular approach to pain management. Since the use of opioids is associated with serious complications, An array of successful non-pharmacologic and non-opioid approaches to pain management may be considered. There are a range of pain management strategies that can be used, including but not limited to the options displayed on this slide. Non-opioid analgesic medications, transcutaneous electrical nerve stimulation, or TENS therapy, supportive devices, acupuncture, biofeedback, application of heat/cold, massage, physical therapy, nerve block, stretching and strengthening exercises, chiropractic, electrical stimulation, radiotherapy, and ultrasound. As a reminder, pain is defined as any type of physical pain or discomfort in any part of the body. Pain is whatever the experiencing person says it is and exists whenever they say it does. The pain assessment interview for residents consists of 7 items. The primary question, pain presence, J0300, and 6 follow-up questions. If the resident is unable to answer the primary question on pain presence item, J0300, skip to the staff assessment for pain, beginning with indicators of pain or possible pain, item J0800. The wording in the steps for assessment for the pain assessment interview has been enhanced to provide more clarity. References to the effects or interference of pain and to the 5-day look-back period have been specified. Let's take a look specifically at pain assessment items J0300 through J0410. The screenshot for J0300, pain presence, has been updated to reflect the renumbering of J0400 to J0410. The coding instructions for this item were revised for clarity. References to pain and its effects and to the 5-day look-back period have been updated. For J0410, pain frequency, the response options have been revised and reorganized. The screenshot has also been updated to reflect the renumbering of J0400 to J0410. The coding instructions for J0410 have been updated. Assessors should code for pain frequency over the last 5 days. Code 1, rarely or not at all, if the resident responds rarely to the question. Code 2, occasionally, if the resident responds occasionally to the question. Code 3, frequently, if the resident responds frequently to the question. Code 4, almost constantly, if the resident responds almost constantly to the question. Code 9, unable to answer, if the resident is unable to respond, does not respond, or gives a nonsensical response. Alternative approaches, such as cue cards, may be helpful communication approaches to consider for some items and some residents. When conducting the pain assessment interview, presenting the response options written on a cue card may help the resident respond to these items. CMS will be offering a set of cue cards to assist providers in administering the pain assessment interview in a written format. These will be made available in accordance with the go-live date for the MDS 3.0 RAI version 1.18.11. Visit the SNF QRP training webpage to find these cue cards when they become available. Take note of the following coding tip. which applies to pain assessment interview data elements J0510, J0520, and J0530. The responses to these data elements should be coded based on the resident's interpretation of the provided response options for frequency. If the resident is unable to decide between two options, then the assessor should code for the option with the higher frequency. Note the different response codes used to indicate if the resident is unable to answer the question, does not respond, or gives a nonsensical response. For J0510, J0520, and J0530, code 8, unable to answer. If the resident is unable to answer the question, does not respond, or gives a nonsensical response. For J0300, J0410, and J0600, code 9, unable to answer. If the resident is unable to answer the question, does not respond, or gives a nonsensical response. Although the response code is different for these items, the meaning is the same. Next, we'll discuss new data element J0510, pain effect on sleep. J0510 replaced J0500, pain effect on function. J0510 captures information previously captured by J0500A. Over the past 5 days, has pain made it hard for you to sleep at night? And gathers additional detail on the frequency of pain impacting sleep. The steps for assessment for J0510 are as follows. Read the question and response choices exactly as they are written. No predetermined definitions are offered to the resident. The response should be based on their interpretation of the frequency response options. If the resident's response does not lead to a clear answer, repeat the resident's response and then try to narrow the focus of the response. Consider this example of the steps for assessment for J0510. The assessor asks the resident, over the past 5 days, how much of the time has pain made it hard for you to sleep at night? The resident responds by saying, I always have trouble sleeping. The assessor replies, you always have trouble sleeping. Is it your pain that makes it hard for you to sleep? The assessor can then narrow down responses with additional follow-up questions about the frequency. For J0510, code for pain effect on sleep over the last 5 days. This visual demonstrates how to code this item based on the resident's response. If the resident responds that pain has rarely or not at all made it hard to sleep over the past 5 days, code 1, rarely or not at all. If the resident responds that pain has occasionally made it hard to sleep over the past 5 days, code 2, occasionally. If the resident responds that pain has frequently made it hard to sleep over the past 5 days, code 3, frequently. If the resident responds that pain has almost constantly made it hard to sleep over the past 5 days, code 4, almost constantly. If the resident is unable to answer the question, does not respond, or gives a nonsensical response, code 8, unable to answer. When coding J0510, pain effect on sleep, If the resident reports that they had pain over the past 5 days and the pain does not interfere with their sleep, e.g., because the resident is using pain management strategies successfully, code 1, rarely or not at all. Let's move along to J0520, pain interference with therapy activities. This is another data element that is new to the SNF setting. J0520 includes a definition of rehabilitation therapy. Rehabilitation therapy is special healthcare services or programs that help a person regain physical, mental, and/or cognitive thinking and learning abilities that have been lost or impaired as a result of disease, injury, or treatment. Rehabilitation therapy can include, for example, physical therapy, occupational therapy, speech therapy, and cardiac and pulmonary therapies. The steps for assessment for J0520 are as follows. Read the question and response choices as written. As a reminder, the question is, over the past 5 days, how often have you limited your participation in rehabilitation therapy sessions due to pain? To complete J0520, code for pain interference with therapy activities over the last 5 days. This visual demonstrates how to code this item based on the resident's response. Code 0 does not apply if the resident responds that they did not participate in rehabilitation therapy for reasons unrelated to pain, e.g., therapy not needed, unable to schedule, over the past 5 days. If the resident responds that pain has rarely or not at all limited their participation in rehabilitation therapy sessions over the past 5 days, code 1, rarely or not at all. If the resident responds that pain has occasionally limited their participation in rehabilitation therapy sessions over the past 5 days, code 2, occasionally. If the resident responds that pain has frequently limited their participation in rehabilitation therapy sessions over the past 5 days, code 3, frequently. If the resident responds that pain has almost constantly limited their participation in rehabilitation therapy sessions over the past 5 days, code 4, almost constantly. Code 8, unable to answer, if the resident is unable to answer the question, does not respond, or gives a nonsensical response. Take note of this coding tip from J0520. Rehabilitation therapies may include treatment supervised in person by a therapist or nurse or other staff, or the resident carrying out a prescribed therapy program without staff members present. Finally, let's look at J0530, pain interference with day-to-day activities. This is the third of the new data elements for the pain assessment interview for SNF addressed in this presentation. The steps for assessment for J0530 are as follows. Read the question and response choices as written. As a reminder, the question is, over the past 5 days, how often have you limited your day-to-day activities, excluding rehabilitation therapy sessions, because of pain? Code for pain interference with day-to-day activities over the last 5 days. This visual demonstrates how to code this item based on the resident's response. If the resident responds that pain has rarely or not at all limited their day-to-day activities, excluding rehabilitation therapy sessions over the past 5 days, code 1, rarely or not at all. If the resident responds that pain has occasionally limited their day-to-day activities, excluding rehabilitation therapy sessions over the past 5 days, code 2, occasionally. If the resident responds that pain has frequently limited their day-to-day activities, excluding rehabilitation therapy sessions over the past 5 days, code 3, frequently. If the resident responds that pain has almost constantly limited their day-to-day activities, excluding rehabilitation therapy sessions over the past 5 days, code 4, almost constantly. Code 8, unable to answer, if the resident is unable to answer the question, does not respond, or gives a nonsensical response. Let's review the changes to Section J for SNF. The Section J intent has been updated. Additionally, revisions have been made to the coding instructions and coding tips in J0200, the coding instructions in J0300, and the response options and coding instructions in J0410. Section J features new data elements, J0510, pain effect on sleep, J0520, pain interference with therapy activities, and J0530, pain interference with day-to-day activities, which have been added to the pain assessment interview. Thank you for reviewing this presentation. If you have questions about the presentation, please submit them to pactraining@econometricainc.com by June 2nd, 2023. Select questions will be answered in Q&A sessions offered during the June 2023 virtual live event.